Hey, what's up? This is Corey Dion Lewis, clinical health coach and host of the Healthy Project podcast. Now, the research shows that social determinants can have a greater impact on your health more than healthcare or lifestyle choices. The purpose of this podcast is to discuss how to improve health and reduce health inequity by speaking to healthcare professionals, thought leaders, and entrepreneurs. Now, if you're enjoying the podcast, give it a review. Or you can also make a donation to the Healthy Project using the link in the description. It takes 30 seconds and it's super easy. Hey, thank you so much for listening. Now let's get started. Hello, everybody. Thank you for listening to the Healthy Project podcast. I'm your host, Corey Dion Lewis. I have a great guest in the building today. I have Cody Hall. He is the founder and CEO of Activa Healthcare, which is a telehealth or digital health company. Cody, thank you so much for being on the podcast with me. I really appreciate it.
Thank you for having me, Corey. Excited.
Absolutely. So before we get into the topic at hand, how about you tell us a little bit about yourself and what gets you up in the morning?
You know, I think what gets me up in the morning varies. I find myself to be a very simple person. I like doing the things that bring me purpose. And so I usually try to be very intentional. Intentional is one of my favorite words. So when I wake up in the morning, I usually like to sit in silence for a while, ponder on my own thoughts. I do language education every morning. I'm seeking to develop a different part of my brain that isn't numbers and data. And then, of course, I do a little bit of reading. So that's usually me in the morning. And then when I'm not doing that, I usually hang out with my loved ones.
Oh, that's dope, man. That's dope. You got to have that. You got to have that, especially with, I'm sure, what you're doing as far as, with Activa Health. There has to be a balance.
There hasn't always been a balance, though. And I think that, it's so funny. Last night I was sitting down with another founder and CEO who I served in the Marine Corps with, and him and I will sit down on occasions and be like, man, I really hate this job. Like, who signed me up for being in charge? And I don't like it. And so we signed ourselves up, so we don't have to blame ourselves. But we sit there and we're talking about the different trains of thoughts in regards to how to balance things. And, I used to be, I wake up in the morning, as I rolled out of bed, I pick up the phone straight to the email, straight to the coffee, straight to the computer. And I was there. And if I remembered lunch, good for me. If I didn't, it's okay. And I just pushed through the day until I'm like, wow, oh my goodness, the sun just went down. And I did that for years. And then I realized that by balancing things and actually working, hours in a day, having objectives that I need to achieve today, doing things for myself, maybe an effective leader, better thinker as well.
Right. So it made you more productive to slow down.
Very.
Yeah, that's a good word. That's good for everybody to know, because no one thinks slowing down will actually increase your productivity, actually get you further than just constantly grinding and not taking that breath.
Yes. It really fuels the creativity, and people undermine, I'm not being creative. Every time you solve a problem, you're being creative. So
absolutely.
That's creativity and problem solving. They're, we can just call them synonyms for each other in some type of way. So.
Oh, awesome. I love that. I love that, Cody. So let's talk a little bit about, I know you're in the telehealth world. How has that been for you over the past couple of years, or for one, when did it start? And, where did you get to where you're at now with that?
I was in healthcare before, working in the chronic illness and population management world. And then, obviously, a little bit before COVID started, before it was even a thing, at this time in January, it was something going on in Asia and in our minds, right? Mm-hmm. And so, it sounds like in Asia, it sounds like another continent issue, not our issue, right?
Right.
And then, I said, this is an idea we should start exploring, is telehealth. And so I started bringing it up, and then eventually the organization I was working with at the time, who I helped become the organization is today, as well as another partner and investor in that organization, said, let's do a joint venture. And the CEO was like, I know just the guy to run it. And so, because I had been asking about telehealth, and obviously I have a track record of just, achieving the objective. And so brought me in, say, hey, Cody, we'll do telehealth. We don't know what we want to do. Just do something telehealth. I'm like, sounds great. I love a canvas. So I stood the organization and kind of just ran with it. But what really I saw the biggest opportunity was patients during transition. And I kind of saw all the different parts of healthcare as its own individual islands. And in order to get to the other one, you had to take a ferry, a bridge, or a plane. And sometimes it was really long trips and complicated. And patients are just kind of left on their own to figure it out. And that's kind of crazy that patients are just left on their own to figure out a very complicated system. So, and that's where we came in, is think of us as a virtual navigator and support organization. We have everything from just general guidance all the way down to the physician's access that patients need at times to seek help.
Right. And that transition of care is so vital, and it's so important. It's so important. Where do you see, where do you see that going forward? What kind of things are you guys doing to kind of help that patient through that transition?
Yeah, well, I think it's doing what we know the patient needs. Now, the system of healthcare isn't quite set up to really make our organization extremely profitable. It will be eventually when they get to something called managed care, which is everyone taking responsibility in the patient's success. So by being a successful part of a patient's process, you'll be incentivized for that success. And so in Octiva, our sole goal is to make sure patients are successful. And so we're in that business. The business isn't just in full swing yet. But what we do is we have patients who have administrative support, what we refer to as transitional care coordination, nurse support, which we refer to as case management. And then, of course, we have a virtual provider network, because the most complicated thing about healthcare is regulatory. So we don't have our own providers. We have to string together a network of available telehealth organizations that provide an array of clinical coverage for different payers so that we can give patients the resources they need. So there's a lot going into building the individual support networks that patients need.
Right. So it's almost like you're a hub for telemedicine. Would that
Correct.
make sense?
We're, if you're going into the Google of healthcare needs, like, where do I find this, or how do I find this? They say, just Google it, right? Instead of Googling it, if you have Octiva, we already have all the pages bookmarked. We have the browser history to expedite the process, and so we're there already. So you don't need to think about, well, how do I get this medication paid for that I can't afford? Well, instead of you trying to look up ways to subsidize medication, we already know it. If we're working with you, it's because we've already established your community, and we're already providing that support in that community. So we have back doors and relationships that allow us to expedite the support these patient needs versus a patient trying to navigate it on their own.
Right. When I speak with people about telehealth, or if it just comes up in conversation, the sense that I get is people know about telehealth. They know what it is, but a very surface level of that. They know what their idea of telehealth is. I can talk to my doctor on my phone or from my computer or from the comfort of my home. But there's more to that, right? So can you kind of explain a little bit, yes, we know that telehealth is a good thing, but is there more to that good thing than just being able to speak with your provider from the comfort of your home?
Oh yeah. So telehealth it's like an onion. If you want to reference Shrek is an onion. He has layers. Okay.
Right.
Telehealth is an onion. It has layers, right? And the very top of that layer, the very surface level that everyone thinks about is concierge. Oh, I desire to see a doctor without leaving my house because it's convenient for me. I desire to get my medication refilled virtually because it's convenient for me. So concierge it's where it's not really a patient necessity for the flexibility that's offered by telehealth. And then you get the telehealth, you get the remote patient monitoring, which is technology virtually powered to give patients the ability to be geographically dispersed and then also receive blood pressure notices, review of heart arrhythmias, and all those different things that go into remote patient monitoring, which we refer to as RPG. And so then you have like telespecialty. We also, the very small parts of our business, but we have telepsychiatry. We have a teleintensivist organization where we actually see patients. Think about a patient who's on the ventilator for COVID, for example. We have doctors that virtually support hospitals specifically for an intense level of care, the highest level of care you can receive. We have doctors who do that virtually. And so when you say telehealth, just think about anything you would do in healthcare from the side of things that is virtual. So instead of it being, oh, I'm just getting prescription, it's everything. It's nurse support, it's care coordination. And so it really gets pretty elaborate in regards to what falls into telemedicine. And then you have telemedicine, and then there's something called telemed, where it's a little different. It gets really nuancy, but it has
Right.
it has a different color hair for every side of the business. And so it just depends on what people need to leverage it for. And that's what's great about it, is it's so flexible.
Right. And, telehealth has been, obviously for good reason, really popular the past couple of years because of what you kind of talked about earlier, the pandemic and COVID-19. So where do we go from here? It's obvious that there's a benefit, and telehealth, in my opinion, isn't going anywhere but anytime soon. But what's the future of telehealth look like, in your opinion?
I think that telehealth can be a lot like cryptocurrency, right? And this is great because both of them are in the kind of same area of like, oh, now they're super popular, but they've been around for a little bit.
Right.
When you look at like cryptocurrency and telehealth, it's from this idea that people who really want it to be successful, some of them really want it to be 100% telehealth. Let's get rid of the idea of an office. We can do everything virtual. It's great. It's like saying we don't need money. We have cryptocurrency. We can just go with it. Well,
Right.
that's not at all. I prescribe to the hybrid model of both in my reference. And the fact is that telehealth has a place in healthcare, and it's going to help us really make gains in some of the inequities that take place in the healthcare world, right? And the reason that's good for us is because there are a lot of patients out there that do not have access to transportation. They don't have access to specialties that their cities or metropolitan areas can't support because they just don't have the population for it. Telehealth is going to help us do that. People who have immune compromises, who need to stay in the safety of their home, it's going to help with things like that. However, it's not going to take over the place of in-person care. And I think that's one thing we got to understand is, where's the balance? How do we strike the balance? At Octiva, I will say it up and down, because I believe it's so true, that primary cares are the center of a patient's care journey. They're the quarterback of the team, and they're there for the patient for all aspects of their journey. Some people will say, we don't need primary cares anymore. Some prescribe to the teledoc way of life, and you can see everything virtually. That's not the case. I think we need to find how it's going to mix together, and time's going to tell. It's going to come down to not only the physicians, healthcare companies, but also the politicians and the regulations.
Right. Yeah. I mean, I think there needs to be a healthy balance. I totally agree with you. It's one thing, when I see patients over telehealth and we're going over, their disease management or whatever the goals we set, is one thing having that conversation when they're in person, and I can feel the energy, or we can really get down to it. But there are also times where, when we're talking about equitable and access to care, where we may see someone that just can't make it to the hospital, and they need to have that telehealth conversation. And that's where it comes into play. I feel like there's definitely a healthy balance there.
I agree.
On the website, it says something about, creating healthcare success stories. What is that? What is a success story? If you have one on top of your mind, what does that look like? What does that mean? What does that look like to you? Or do you have any good ones?
Definitely. We have one every week we share. We see hundreds of patient encounters per month. And so luckily for us, the population we support has a great opportunity for making positive impacts. And so we see a lot of Medicaid, Medi-Cal population.
Mm-hmm.
And so with that, I think one of the ones I use very frequently is patients who can't afford medication. So we had a patient not too long ago, probably not the same patient because it happens so frequently, but a patient who was prescribed a very expensive medication. And this patient not only was under Medi-Cal, but they just applied for Medi-Cal. So they hadn't had Medicaid before they went into the hospital. The hospital applied for them. So here is a patient being prescribed a $600 out-of-pocket cost for this medication. And when we asked them for the follow-up, hey, have you taken your medication? No, because they can't afford it. And that right there is a simple way that Octiva can step in and ensure a patient gets the necessary 14 days of the antibiotics they need, so they do not so there's not an exacerbation, so there's not an acute episode that arises from the prescribed antibiotics that is needed to subdue the illness. And so, something like that, it's so simple. I refer to it as low-hanging fruit. Now, every patient we see, it's not, an act of miracle that we are able to support them. Sometimes it's so simple. Medication sent to the wrong pharmacy, very common. And now the patient, well, how do I get it? You need to go back to see the doctor and they'll send to the right pharmacy. What does that require? It requires them going back to the hospital. And so we see it as like these really small things. Like we think, oh my goodness, they must be doing great things. Now there are ones that we have that are just, the details get a little crazy and we can't get into those success stories, but there are some crazy things that go on in transition that I am amazed by the way the providers and the nurses are able to handle them virtually. And it's incredible to see those successes, but really it's the everyday hero things that really prevent patients from having unnecessary complicated journeys and spending unnecessary money, both for the system and themselves while transitioning.
Yeah, and that goes back to what we were talking about before. That transition of care is, it may seem like a small thing or low-hanging fruit, but to that patient, man, that's big.
Everything. Well, that's why we always say, one of my common statements is sometimes we are the last inch for the patient, the extra icing on the cake, and sometimes we're the last mile for that patient. We're all they have. And so, and when we're that all the time, and we come across patients who are underinsured, undocumented, right? And where we're sitting in the patient's like, hey, listen, I'm not a citizen. And like, hey, listen, we're not immigration services. So our job is to make sure, right? Our job is to make sure that you are successful because you're going to hit the system anyways. You came from this hospital, you are being paid by the government. Someone's incurring a cost because of your success or failure. We're here to make sure that doesn't happen. We're here to make sure you're successful. So those things, they don't matter to us. We are here for a purpose, to have patients be successful and to make sure that our partners benefit from that success, from the patients making it, as well as avoiding unnecessary traffic and unnecessary readmissions.
That's awesome. That's awesome. Cody, thank you so much for being on the podcast with me today. I truly, truly appreciated it. For anybody listening that wants to know more about your company, more about you, where can they find you?
LinkedIn's always a great spot. You can get all of our information at octivahealthcare.com, but you can also find myself very active on LinkedIn, Cody Hall, and then Octiva Healthcare, of course. So those are the best places to get a hold of us and contact us.
Awesome. Well, again, Cody, thank you so much for being on the podcast. And everyone, thank you for listening to the Healthy Project podcast. I'll let you next time.